Hi, so my name is Sohayla Eldeeb. I am a researcher at Stanford University, as well as the former director of global outreach at Zero Hour. Actually, I feel drawing back to COVID-19, it's currently going on as well, is a perfect example of how climate and health intersect, because the same exact populations and communities that were disproportionately affected by COVID-19 are also the same communities and populations currently disproportionately affected by climate change. The same communities, such as sub-Saharan Africa or Southeast Asia, that are facing an influx of consequences due to the climate crisis, are the same exact ones that are projected to be even highly influenced by infectious diseases, especially malaria. I feel global health has a lot at stake when it comes to advocating for climate change, because numerous respected organizations such as the Lancet Countdown have labeled that the climate crisis is the greatest threat to global health worldwide. So I think there's a lot of research out there that shows how global health and climate change are directly intersected. But in terms of getting that in a more mainstream space and advocating for it, I think we definitely need to do a better job. Like the fact that up until COP27, we're up until COP28, we still have not had a single health themed day says a lot on the climate stage, that this isn't kind of like a theme that people are advocating for. It's more of like a co-benefit that they're talking about. So definitely advocating for more spotlight on the health issue being a core factor and consequence of climate crisis is very much needed from all of these very big organizations. And also, of course, uplifting the organizations and nonprofits and grassroots organizers that have been doing the work for years and years, and have just been kind of overshadowed or really undermined when it comes to spaces that can have these people on stage and talk. So let's start by reframing what it means to be under threat due to the climate crisis. It is the threat of today, not the threat of tomorrow. And essentially, two, we definitely need to start talking about the health issue being a consequence or kind of a direct factor of the climate crisis. I feel a lot when I go to these COP or other conferences, organizations, they view health as a co-benefit of climate solutions. So because we're targeting the climate crisis, we are in turn also getting this benefit of a cleaner future, a more sustainable community. But we need to address health on its own stage and understand that currently there are literal infants being born with defects due to rising heat levels. There are children who are facing higher hospitalization asthma rates due to air pollution. There are communities facing waterborne diseases because of the water pollution. So these are things that are happening today. So the threat is already here. So essentially trying to reframe how we're talking about it and also how we're advocating about it and presenting solutions that are directly targeting the health consequence of the climate challenge rather than viewing it as a benefit when it comes to just throwing the climate solutions out there.